So my name is Robert Hayes. I'm the Community Outreach Librarian here at the Tewksbury Public Library. One of my responsibilities is adult programming, and just really want to welcome everyone for being here tonight. I think this is going to be a good one. A couple of things. Just wanted to let folks know that I am recording tonight's event. We will be uploading this to YouTube, and we are streaming it live to the library's Facebook page. So just be aware that we are recording. The camera is only going to pick up on Kathleen and her PowerPoint presentation. It won't capture anyone's faces in the audience, okay? Also, we're going to communicate tonight via the chat. So you won't be able to use audio, but if you have any questions or comments during the presentation, just type them into the chat, and I'll make sure that Kathleen addresses them at the end of her presentation during the formal Q&A. So we'll take questions and comments. You can type them throughout, but we're going to address them at the very end of the presentation during the Q&A period. Just to set expectations, I anticipate tonight's program lasting approximately an hour. Kathleen's going to talk for 40 to 45 minutes, and then we'll take 10 to 15 minutes of questions. But before I introduce Kathleen, I just wanted to remind folks that you'll be receiving an email from me tomorrow morning. Those that are watching on Zoom, you'll be receiving an email, and in the email will be a link to a feedback survey. Please fill that feedback form out. Let us know what you thought about tonight's event and what you'd like to see for future events here at the library. That would be greatly appreciated. I do want to acknowledge the sponsors of tonight's program. So tonight's program is brought to us with federal funds provided by the Institute of Museum and Library Services. And this grant funding was administered by the Massachusetts Board of Library Commissioners. The library recently received a CARES Act virtual programming grant in the amount of nearly $3,000. And over the course of 3 months, every Thursday night, we are partnering with an area museum, aquarium, or zoo to bring some learning to our patrons via Zoom. And tonight, of course, we're partnered with the Public Health Museum, but I did quickly want to plug next week's program. Next week, we're partnering with the Museum of Science. So next Thursday, November 5th at 7 o'clock, the Museum of Science will be joining us with their virtual planetarium. They'll be using their worldwide telescope program that will allow us to travel to different planets in the solar system and beyond. And so next week's talk is for all ages, adults, teens, and kids. It's going to be one of those talks that I think is for the entire family. So again, that's next Thursday, November 5th at 7 o'clock via Zoom, and you can register on the library's website, tewksburypl.org. I also just dropped the registration link into the chat box. All right, I think it's main event time now. Let me get Kathleen's bio up, and we will get started. Let me just take a peek at the waiting room. All right, I think we're good. So we have nearly 50 people joining us live on Zoom, and we have another 10 or so watching live on Facebook. And I'm sure, Kathleen, you're going to become a YouTube sensation, and you'll receive hundreds of views on YouTube once we upload this there. So tonight's presentation is called The History of Nursing and Pandemics with the Public Health Museum. And tonight we're really focusing on the story of Lillian Wald, who's considered the mother of public health nursing. And tonight's presentation is led by Kathleen Herson, RN-MS, who's a graduate of Framingham State University and the University of Massachusetts Medical School's Graduate School of Nursing. During her career, Kathleen served as Director of Education and Training at the Massachusetts Department of Public Health Division of TB Prevention and Control, and was Public Health Nurse Manager of the Regional TB Clinic in the town of Framingham. Kathleen was also Program Secretary of the Nursing Section of the International Union Against Tuberculosis and Lung Disease. And so the bottom line is she has over 30 years of experience in public health. So all of us, let's give a big virtual round of applause to Kathleen for joining us here tonight. And Kathleen, after my 5-minute rambling introduction, you can finally take it away. Thanks so much.
Okay. Thank you so much. Thank you. Good evening. I'll begin by thanking the Tewksbury Library for hosting this presentation and the Public Health Museum's invitation to present during these historic times. It is a pleasure to tell you about these heroic nurses who worked over 100 years ago and will give us an historical perspective like a beacon of hope during these challenging times. It begins with Lillian Wald, a renowned humanitarian and mother of public health nursing. Wald was born in 1867 to Jewish parents that immigrated from Germany to seek economic opportunities in the US. Her father was a prosperous optical dealer, and Lillian spent most of her childhood in Rochester, New York. Her home overflowed with books and music. She attended private schools and was sheltered from the challenges of the poor. However, her mother and aunts were actively involved in social reform and helping the disadvantaged. While being an excellent student, applied for Vassar College at age 16, but was rejected because of her young age. Later, she was so impressed with a nurse that came to care for her sister, she decided to take up nursing studies at the New York City Hospital School of Nursing. She graduated at 22, and shortly after, she enrolled in Women's Medical College in New York. This slide is from a presentation given by Corey Bova, one of our peer mentors, for the Public Health Museum's outbreak course that we had last summer. In the late 1800s to early 1900s, life for the poor was very difficult. Cities like New York housed impoverished populations in crowded, dirty, unsanitary tenements, unfit for human habitation, that lacked proper ventilation, water, and plumbing. Communicable diseases like cholera, typhus, and tuberculosis were common. Factory conditions were unsafe and unsanitary. Injuries were common. Wages were low. Many children worked in these unsafe conditions to help support their families, depriving them of an education. Streets were dirty and lacked sewer systems. Proper street cleaning and sanitary laws had not been established yet. The Alms houses, like the Tewksbury Alms House built in 1852, were open to the care of the poor. Pictures of on the middle is Anne Sullivan Building in the interior of the sunroom of the female hospital. At the time, the Tewksbury Hospital was known to be the newest and best hospital in the country. Patients with tuberculosis and chronic diseases were treated there, and a training school for nurses was opened in 1898. The most famous patient was Anne Sullivan, who taught Helen Keller how to communicate. Anne's parents immigrated from Ireland during the Great Famine of 1840s. In 1876, after Anne's mother died of tuberculosis and her father abandoned her, she was sent to Tewksbury at the age of 10, along with her young brother, Jimmy. Anne was afflicted with trachoma, a bacterial infection, which damaged her sight. Her brother was suffering from tuberculosis, which caused his death 4 months later. To best describe the experience that led to Lillian Wald on the path to her life's work, I will quote her. One day, while teaching a class for new immigrants, a child of one of the students came to the class. The little child asked me to help her sick mother, and from the incoherent account, I gathered that the child had been born. The child led me over broken roadways, dirty mattresses, heaps of refuge, between tall and reeking houses where fire escapes were rendered useless, by piles of discarded household goods, past odorous fish stands, for the streets were the marketplace. Unregulated, unsupervised, unclean, past evil smelling, uncovered garbage cans, and worst of all, where children played. The child led me in through a tenement hall, into a rear tenement, and finally into a sick room. The maladjustments of our social and economic relations seemed to epitomize in this brief journey of what I found at the end. The woman laid in a wretched, unclean bed, soiled and hemorrhaging, in a family of 7 living in 2 rooms with boarders, the father a cripple. At the end of my ministrations, they kissed my hands. It would have been some consolation if I could have defended myself as part of a society which permitted such conditions to exist. That morning experience was my baptism by fire. That day, I left the laboratory in the college. What I had seen had showed me where my path lay. In 1893, at the age of 26, Lillian Wald invited her nurse colleague, Mary Brewster, to join her plan to move into the neighborhood of the Lower East Side of New York as nurses and to identify themselves with the socially. They found living quarters on a 5th floor walk-up apartment and remained there for 2 years. At the time, Wald admitted that they were both quite naive and ignorant, but this we did know. We cared for these neighbors. Doc called Wald the leading lady who would shine on everyone like the sun. Wald was the diplomat and executive. Doc was the scholar who wrote the first book for nurses called the Materia Medica for nurses, and was more experienced and realistic. These pictures show Wald and Brewster out visiting patients and Wald inside a tenement house. They received referrals from doctors, charitable agencies, and individuals in need. At the time, 90% of the poor received care at home, since most could not afford a doctor or hospital care. Soon, the demand for their services overwhelmed them. With people constantly coming to their 5th floor walk-up for help, an Irish neighbor began to help by recording the names and addresses of the visitors that came by and relaying messages when the nurses were out visiting the patients. Here are 2 experiences described by Wald. One night, I was looking for an address to see a sick child. I asked 2 men living under a bridge. They told me it was too dangerous to be out alone and accompanied me to the house. And after the visit, both men escorted me home. And here's another one. It was during the economic panic of 1893 in the early morning, before we had time to put the kettle on, people began their tramp up our 5 flights. And the procession continued after our nursing rounds were ended till the minute of the night before we sank into fatigued sleep. They came begging us to help them find work, or at least give them a ticket entitling them to a few days' work, provided as a relief measure. Wald's most generous benefactors were Miss Solomon Loeb and Jacob Schiff. Early on, Wald approached Mrs. Loeb, the wife of a banker and mother-in-law of another banker, Jacob Schiff. This is how Mrs. Loeb describes her meeting with Wald. An extraordinary young woman came upon me. I don't know if she's a genius or whether she is mad. She wants to start a visiting service on the Lower East Side and would like me to help her. I prefer to think she's a genius, so I'm going to ask Jacob to help me give this woman a chance. In 1895, Jacob Schiff bought Wald a building on Henry Street, where Wald founded the Henry Street Settlement House. 3 more buildings and a playground were added in 1902, summer camps in 1908, and a theater playhouse in 1915, and a music school in 1927. On the left is a picture of the first settlement house building, and on the right is the playground for children that Wald had built behind the settlement house. It was the largest playground on the Lower East Side of New York. The settlement house movement began in Britain in 1884 when middle-class London reformers established the first settlement house in East London to provide social service and education to the poor who lived there. Inspired by the British movement, the American social reformers began founding settlement houses in the late 1880s to respond to the growing industrial poverty. Most of the houses were in Boston, New York, and Chicago. The Henry Street house was a vibrant place where influential people lived and visited. Here are a few descriptions of who were there. Two distinguished nurse researchers and authors, Adelaide Nutting from Johns Hopkins University and Isabel Stewart from Columbia University, joined and lived at the settlement house. Elizabeth Farrell, a humanitarian, devoted to the education of the mentally challenged child and in the public school system. Wald believed in Elizabeth that all children should be able to attend school regardless of their disability. Union leaders such as Sidney Hills, Florence Kelley, the General Secretary of the National Consumers League. Wald described her as a nurse who goaded others with the whips of her wit, her quickness, her bottomless sympathy, her readiness to act wherever new danger menaced the child, or the people whom she believed were imposed upon by outdated legislation and other discriminations. She was responsible for ethic gains through legislation. Distinguished Black writers and poets and musicians, distinguished artists performed at her theater and expressed gratification for the audience that appreciated him. Rabindranath Tagore, winner of the Nobel Prize in Literature, read poems at the Little Theater and visited for tea. The Black pastor Fredericks, who said the settlement was their best friend. Wald bought an organ and donated money to clean up a storefront that was their church. Young women from as far away as China came to inquire about the public health nursing. Members of the Japanese Red Cross Commission came, governors of New York. Madame Nadeau, distinguished associate of Gandhi. And there was an infrequent visitor, Peter Caulfield, a Black homeless man who would show up from time to time over the years. Each time he was given a room and soared back to health. Typically, he had arrived very malnourished and very sick. A nurse once asked, "Why do you come?" And he answered, "Where would I go if I were hungry, if not to the poor?" Wald believed the door should swing open without hindrance. A policeman once said of a visitor, referring to Henry Street, "It's the house where if the King of England came to America, he sure would be taking lunch with the ladies." Wald believed nurses to be an economical, practical solution to the complex problems of elevating the poor immigrant families to a more ordered and a healthier existence. She coined the phrase public health nurse, which she described as a visiting nurse with a civic duty to work for social reform, to promote a healthy society, like affordable health care and health and safety at school and home and work. In the picture, public health nurses are outside the Henry Street settlement house. These nurses specialized in disease prevention like tuberculosis, also called TB. The Henry Street nurses were quite successful, as noted by Wald's statistic. Of the 3,000 patients with pneumonia they cared for, 8% died. However, 31% died in large New York hospital. In 1910, Wald developed a public health nursing lecture series at Columbia University. Henry Street supported the expansion in the nursing courses at Teachers College at Columbia and helped to facilitate the nursing school at Yale by hosting meetings at the Henry Street house. She trained over 3,500 Red Cross nurses in the United States and nurses from Europe, Asia, Africa. Also visited Henry Street and attended her lectures. She founded the National Organization of Public Health Nurses in 1912. In the first picture is a nurse on her way to visit her next patient. She was climbing over the rooftops instead of going all the way down and back up the stairs to the next tenement. The middle picture shows a nurse in home checking on a mother and child. What was it like when Lillian Wald came to visit? Rose Cohen, a Henry Street alumni, tells us in her description of a visit of Lillian Wald when she was a child. Miss Wald comes to my house and new world opens up for us. We recommend her to all of our neighbors who are in need. The children join the clubs, and I spend a great deal of time there. Miss Wald and Miss Brewster treat me with affectionate kindness. I am to be sent to the country for health and education. Despite all the hardships, it was a rich neighborhood with interesting people that Wald invited as guests to attend lunch and dinner at the settlement house, and where women with many nationalities shared their favorite dishes. The last picture is a class of a new mother at Henry Street. Wald said the sick room was the classroom, emphasizing the importance of teaching patients, so that there were many education programs on how to care for the sick and children. Classes were held for children. There were music lessons at the house, and evening classes were held for children that were working in the factories during the day. There were clubs for children and sport events. Some Henry Street athletes became stars. Ernest Poole, a Henry Street alumni, explains his experience. I came here when I was a youngster. Thank God. I came into a personal, intimate home with windows looking all over the world. I came here again and again. Wald brought together the educated and influential people, poets, musicians, writers, to hear about the struggles of the community members. Jacob Schiff attended one such evening and was shocked by the poor working conditions described by the workers and the men unable to support their families, and a derogatory statement from a factory owner of a strut shop. To the poverty-stricken and the earnest workers, so Schiff quietly gave Wald money to support the strike. The settlement house had a room set aside for union meetings and weddings. The settlement house, Wald, along with some Henry Streeters, came to Lawrence in 1912 to support the workers during the bread and roses strike. Lillian Wald met Lee Frankel when they were members of the Jewish Charities in New York City. At the time, insurance policies were mainly life insurance policies to cover burial expenses. In the 1880s, there was a movement in Europe to socialize insurance companies and international healthcare. The beginning of socialized medicine, which started in Germany. Frankel at Metropolitan Life Insurance believed that insurance companies in the US had a social obligation to improve the health of its policyholders. His early work centered on TB prevention at a time when TB caused more than 150,000 deaths and incapacitated between 2 and 3 million people a year. $4 million in TB-related insurance claims were paid in 1915. Lee Frankel was having difficulty with his health promotion program. The agents were only paid when they sold policies, so were not interested in spending time collecting health information or dismissing health insurance. Lillian Wald suggested that our nurses could do a better job at assessing illnesses and teaching health practices. So began the Lillian Wald partnership with Metropolitan Health Insurance. The nurses were paid 50 cents a visit, and after 3 months, the program was so successful, it was adopted across the country. By 1914, Wald's program resulted in a 12.8% decline in deaths among the policyholders. And by 1925, over 240,000 lives were saved at an estimated savings of $43 million. Frankel wanted to conduct a community-wide experiment to test the theories of public health and determine if it was possible to reduce deaths and disabilities due to diseases like tuberculosis. Framingham was chosen as the site, having the demographics of a typical city and town in the United States. Framingham Community Health and Tuberculosis Demonstration was established to determine whether it was possible to reduce TB deaths and disability. Metropolitan Life Insurance funded the demonstration. The National Association for the Study and Prevention of Tuberculosis and Lillian Wald oversaw the implementation. Local doctors and nurses were trained that volunteered to assist with the demonstration. They received training from experts in the field. Framingham, this is a picture postcard of Irving Square in downtown Framingham in the early 1900s. In 1917, the life expectancy was 48 years for men and 54 years for women. It was before most vaccines were available and before antibiotics and antiviral drugs were discovered. Life-threatening infectious diseases were common, like diphtheria, typhoid fever, scarlet fever, meningitis, tuberculosis, and polio. Many children died before the ages of 5 from one of these diseases. Tuberculosis was feared, and many patients died or were sent to sanatoriums like the Tewksbury Hospital and remained there for years. Health departments had little information about how many residents had TB in their cities and towns. Most patients with TB did not seek care until the advanced stages of the disease, making it impossible to cure. Since it was before anti-TB chemotherapy, treatment was limited to fresh air, healthy diet, rest, and some surgical interventions. Wald sent a team of nurses, seen in the picture, to conduct the initial canvassing of the community and to train the local nurses. One remained to assist with the project through the entire 6 years. The households were canvassed to determine the makeup of the family and the presence of diseases. It was followed by an examination campaign that provided 14,000 residents. 82% of the population received free physical exams. Imagine, in 1917, 82% of the population in your town had a physical. Nurses collected family histories and arranged for patients to receive follow-up tests, x-rays, treatments, and they followed patients in the community. The key public health intervention that made the demonstration a success were the use of active case finding, early diagnosis, and contact tracing. Rather than wait for patients to seek medical care, the public health team were searching for patients with tuberculosis. This led to the diagnosis of patients in the early stages of TB disease and more successful treatment. Fresh air camps were open for children and adults with tuberculosis. They were day camps. They provided fresh air and rest and a healthy diet. It was an opportunity for the nurses to monitor the health status and visit the homes of the patients, conduct contact tracing to find new cases of TB, and teach the family how to stay healthy. The camps also provided a place to isolate the infectious patients from the community, thereby reducing community transmission. 11 cases of TB and many undernourished children were found in the schools. 33% of the children under age 7 tested positive for tuberculosis. Open air schools were encouraged where windows were open and seating well spaced. TB can be transmitted by drinking milk from a cow with tuberculosis. 20% of the cattle in Framingham tested positive for TB, and 16% had symptoms. Children are particularly prone to this form of TB transmission. Pasteurized milk eliminates the risk. Milk's pasteurization increased from 15 to 70 to 80% in the town, and this helped to reduce the infant death rate. Every factory in town was inspected, and safety policies were installed. This is a picture of Denison Manufacturing Company, the main employer in the town. This cross logo was representation of the crusade against tuberculosis, which was printed at the Denison factory. Henry Denison, the president and owner, lobbied for Framingham to be chosen for the demonstration. Denison was the largest company and provided mandatory exams for new employees. The company had a medical office with a doctor and nurses. 2 TB cases were found at the company. The company paid for the care. One was hospitalized at a sanatorium for over a year. Denison also offered its employees sick benefits and free hospitalization for a family at a cost of $2 per year. Like the classes at Henry Street Settlement House, classes were given in Framingham at the Civic League on childcare, worker safety, sanitation, and disease prevention. Weekly health letters were posted in the local newspapers. Such topics as how to protect your child from mosquito bites and how to prevent dental cavities and infectious diseases like tuberculosis. 4 baby clinics and 2 pediatric nurses were added to the town to help reduce the infant death rate. The TB demonstration nurse, Edith Blades, pictured in the picture on the right, spent her time looking for active TB disease and closely following those at risk with TB infection or prior active disease. Plus, she managed the children in the adult health camps, pictured on the left. The nurse's constant observation made an important contribution in detecting TB in the early stages. Blades was asked, what made the demonstration a success? She said, constantly going in and out among the town people, finding new cases, gaining their trust, and helping them to understand how to protect themselves. This is a similar quote to Wald, who said, health messages must be carried to the people by word of mouth and passed up and down the streets from house to house. Prior to the demonstration, Framingham was like other communities. There were only about 11% of the actual TB cases that were known or reported, or the tip of the iceberg. The demonstration discovered most of the TB cases in the community were not reported. 242 new cases of active TB were found, many in the early stages of the disease. And an additional 100 patients had evidence of prior disease, putting them at risk for relapse. The demonstration proved you could prevent TB. TB decreased by 55%. TB death rates decreased by 68%. Early diagnosed cases increased from 45 to 75%. Infant deaths decreased by 40%, and overall deaths decreased by 16%. The demonstration provided a model for communities to set up their public health program to determine their TB risk, to find TB cases, and reduce their deaths and disability. It was called the Framingham Yardstick. It was adopted by the National Public Health Service and used across the United States, Canada, and Europe. Dr. Comstock, a well-known TB expert, called the Framingham demonstration the crown jewel of the Metropolitan Health projects. The TB demonstration created a model that sparked an era of public health, community control of infectious diseases, but also a population-based approach to seeking predisposing factors leading to many chronic diseases of unknown origin, like, for instance, cancer. It paved the way for the Framingham Heart Study. In 1918, the demonstration was halted to deal with the influenza pandemic. The virus infected roughly 500 million people, 1/3 of the world population. and caused 50 million deaths worldwide. In the United States, 25% of the population caught the virus and an estimated 650,000 died. Like today's coronavirus, the TB 1918 flu pandemic created a major public health emergency. There were shortages of hospital beds and the need for field hospitals. There were shortages of doctors and nurses, as many had been drafted into the war or were sick themselves with the influenza. Routine health visits and clinics were suspended. With no vaccine to protect against the virus, people were urged to isolate and practice good hygiene and limit social interaction. All public gatherings, places like schools, churches, theaters, dance hall, bars, bowling alleys were forced to close. 3,000 sailors who were often housed in close quarters in barracks were moved to the military camp at Mustard Field in Framingham to be separated and protected from the severe influenza outbreak in Boston. The townspeople joined in the struggle by donating bedding to the hospitals and using the kitchens at the high school and college to prepare food for the hospitals, the sick, and the poor. Many teachers volunteered and helped the nurses in the hospitals. The townspeople were well informed since the public health professionals gave frequent, consistent messages on how to protect themselves from infection and what to do if they became sick. Those who were sick were monitored and instructed to remain home. Townspeople were instructed to go outside into the fresh air and walk, rather than use crowded trains and trolleys. Frequent health letters were posted in the local newspapers. Like Framingham, many towns and cities across the United States had the lowest death rates in the country from the 1918 flu pandemic because they followed the advice of the public health professionals. The highest rates from the influenza pandemic occurred in cities and towns that ignored public health warnings. In 1918, meanwhile, Wald was chairing the newly formed Nurses Emergency Council that coordinated private nursing agencies and the city inspectors to deal with the influenza pandemic. Wald slept very little, caring for the patients and nurses, enlisting volunteers for work, and appealing to the benefactors to fund. She wrote of her experience in an article titled, "When the City is a Great Field Hospital." These forces, municipal and private, Catholic, Jewish, and Protestant, were mobilized, ready for action in less than 24 hours after forming the council. Nurses visited and cared for the sick in the city, in their homes, mostly, since those sick were requested to stay home. There were large field hospitals at Central Park, mostly to isolate infectious patients living in crowded tenements. To help recruit volunteers, Wald went out to an announcement titled, "A Stern Task for a Stern Woman, for humanity calls them to this task, and lives depend on their answer." She arranged for women to stand at the steps of Tiffany and other Fifth Avenue shops to convince the wealthy customers that would have departed for country homes away from illness and germs in urban life to answer the call and volunteer to help the sick in the city. It paid off. Hundreds of men and women answered the call and helped all of the sick in the city. Wald concluded, the city should remain on constant readiness to provide this level of service because severe outbreaks of epidemics weren't extraordinary. Rather, their occurrence are frequent enough to be anticipated and not inherently incapable of administrative control. Wald said, a window open. As windows open, we often see what is good for the individual is often good for the many. No organization needs proceeds far with fixed ideas. I hold to my faith that the first essential to human relations is respect. Poverty is a social issue, not an individual failure. Therein lies the power to bridge the difference. Gaiety, humor, and happy home life were found under these harsh conditions. Many families later prospered to have a piano in their home and money for music lessons for their children. Some were able to move away to better locations and higher standards of living, but frequently came back to keep alive their friendships. So there were many reunions at the Henry Street Settlement House. After 125 years, the Henry Street Settlement House continues to provide services in the Lower East Side of New York. These services include home visits to the sick, medical, clinical care, senior services, job readiness, mental health services, education, preschool learning, college access and retention, after-school programs, and high school admission counseling, sports, recreation, and the local theater. Now that's a legacy. As an advocate of justice and equality, Wald served people from all sections of society, irrespective of their race, class, and thereby promoting health and sanitary awareness amongst them. She worked on reforms pertaining to child labor and the rights of all to have health care, education, and live in healthy environments. She was in frequent contact with Eleanor Roosevelt and promoted the New Deal. She tirelessly worked for suffragette and supported racial integration. I believe we are better off today because of the nurses like Lillian Wald and her network of social reformers. Thank you. If anyone has any, we'll stop here for some questions, but I'd just like to let everybody know that if you're interested, please visit the Public Health Museum at www.publichealthmuseum.org.
And you can keep your slides up, Kathleen, that would be great.
Yeah.
Type that into the chat there. Great. So if anyone has any questions, and now would be the time, you can type them into the chat and I will relay them to Kathleen. We did have a question while you were speaking. Virginia wanted to know, in 1852, was the Tewksbury Hospital also used as an orphanage? Is that something you happen to know, Kathleen?
Well, they did have children because Anne was sent and it did house the poor. Mm-hmm. So I don't know if it was called an orphanage or but they housed children. So I guess you could say it was.
Great. So Paige chimes in. Paige is one of the volunteers at the Public Health Museum. I think she's on the board. She wrote, they did have children, but the building was, there in 1854. Okay, thanks, Paige. Did anyone have any, so Paige clarifies that it was not officially an orphanage. Okay.
Oh, okay, great. Thanks, Paige.
Dee wants to know, what involvement does the Henry Street Settlement House have in the current COVID-19 pandemic?
Okay, what I could see is, you know, they continue to have their services, and they do continue to have their visiting services in public health systems. So my guess is they're pretty involved in visiting patients that are sick. And I would suspect that they would be involved also in teaching the community how to protect themselves. They do have clinics there that I know would probably be open, much like ours, where you'd have to plan appointments and things like that. They're available. As far as all the other services, I suspect it would be a lot like what we're witnessing here, diminished but available.
So any additional questions for Kathleen? If so, please get them into the chat. And Kathleen, I'm looking at your references here. Was there a book? It appears. Was there a book written by Lillian? Is that what?
Yes, yes, she wrote a couple books. One is Windows on Henry Street. And she also wrote a biography and letters that she had. One of the books has a lot of her letters in them and her writings in them, which is the Cross book. There's also a play in that book on Henry Street.
And so, Kathleen, let me ask you, why, clearly you have a deep background in public health. What prompted you to create this presentation for Lillian?
Well, the initial reason I did this is we have an outbreak course at the Public Health Museum, and I spoke on public health nursing. And you can't speak on public health nursing without discussing Lillian Wald. And then, you know, there's so much that the group did that we're using today in the coronavirus pandemic that I think is valuable in teaching us and encouraging us and helping us understand with what is happening around us that I created this.
Great. So Christine wants to know, could you talk a little bit more about her involvement in the suffrage movement? I think you referenced that. There's a book here referencing it, and then I think on the previous slide, I think you might have mentioned something.
Well, to understand that the Henry Street Settlement House was a real vibrant place, and there were many people involved in many social movements at the time, whether it be labor movements or, you know, improving working, child care, protecting children, the environment. So there was also among them, being activists that they were actively involved in the suffragette. So they would attend some of the, you know, demonstrations, and they would also education was really important to Lillian Wald. So there would be a lot of education that would be surrounding that to educate the community and what that would mean. And another one important piece of history is the involvement of the nurses during the war, involvement of the women during the war, and also the additional involvement and the necessity of having them during the pandemic. And their contribution actually advanced women's right to vote, the suffragette, because they could no longer deny that the women were play a significant role in our society. So all of that really helped.
Dorothy just has a comment saying that she didn't hear you mention that in 1902, Lillian established a school of nursing at in New York City, which was the first school for nursing in the United States. There was
a school, and Brewster had been involved, but she had essentially established, it wasn't the first school, but she had established the public health program, public health nursing program at that school. She was the one that established that.
Excuse me?
Yes?
Yes, she established school nursing in the United States. She established the supervision of children in schools. And that was the first school nurse in the U.S., Lena Rogers.
Oh, I see.
And California was next to follow establishing school nursing. And then Boston in 1905 also established school nursing. So that was very important that she did that.
Right. Thank you for correcting me, Dorothy. I was relaying the question wrong to you, Lillian. Dorothy did write school nursing. I thought she meant school.
Oh, I'm sorry.
That was my fault.
Oh, I was, okay. Yeah.
So let's wrap up while I'm behind here. So Laura's question is, what would you say to novice nurses who have interest in the public health nursing field.
What would I say? Who's interested in public health?
That's right.
Okay, I think public health is very exciting. It's always changing. Every day is different. It's investigative work. It's creative work, and it does much as Lillian Wald was connected to social reform. If you're working as a public health nurse, you automatically do become involved in social reform because you see the inequities very close in society. So I think I had a great career. I loved public health, and I started in Boston, and then worked in Framingham, and then worked at the state level. So I would highly recommend it. I think today as well, we're finding that there might be some invigorating resources going into public health. So, and public health it just can go in many directions. The other thing today, I think that we did begin to get involved in is environmental impact on health. And nurses got involved in that too.
All right, I don't see any additional questions. Mary says, excellent informative program. Many thanks. Judy says, thank you for the program. Love the museum. Let's see here. Yep, Laura says, thank you. So I think folks will wrap it here. So if anyone, for those of us on Zoom, I'll send you an email tomorrow morning. Please fill out the feedback survey. Let us know what you thought of tonight's event. Also, I hope you join us for one of our next 3 museum virtual programs. We have the Museum of Science next Thursday, the Peabody Essex Museum in 2 weeks, and the Museum of Fine Arts in 3 weeks. So that's who we have coming up in this series. Hope you can make it. I want to thank the Public Health Museum for, in particular, Paige and Pink for helping organize tonight's talk. And I wish everyone up at the Tewksbury State Hospital or Tewksbury Hospital and the Public Health Museum, I wish them well during these difficult times. So Kathleen, before I end the session, did you have any last words you wanted to leave with the group?
What I would say is that there's quite an education you can gain from visiting our Public Health Museum. But thank you all very much. I appreciate it.
Great. Yep. So thank you, Kathleen. Thank you, everyone, for joining us tonight, and I hope to see you at a future event. Thanks again.
Okay. Thank you.